A cyst bursting takes you from a stage 1 cancer to stage 3 or 4. Kia ora, my name is Ruby Smith. I'm 35 years old and I was diagnosed with mucinous ovarian cancer stage 3 in June 2023. I had just had a baby, and leading up to it I was pregnant and I had a growing cyst that they never tested. I was actually really frightened because I ended up in hospital 3 or 4 times with excruciating pain, and I kept saying, I think it's the cyst. But I was also quite naive when my obstetrician said to me, I'm pretty sure it's not cancer, you're too young. I just believed him, and I guess a part of me wanted to believe him as well. Nobody wants to be diagnosed with cancer. 2 weeks after I gave birth, I got really sick, and I said, I think the cyst has burst. I remember the doctor looking me in the eye. I was freaking out, and she's like, it hasn't burst. A week after being on antibiotics in hospital, they did the surgery and it had burst and it had spread everywhere. Knowing that it could have been prevented, that was so, you know, I still think about that sometimes.
I discovered a lump in my lower abdomen and just laughed it off. I assumed that I had a hernia, because who wouldn't after that? I was so fatigued, and it's, looking back at it now, of course it's not normal, but at the time it crept up on me slowly. I basically tick all of the boxes, which I think was a surprise to all of us, because it's not something that crosses your mind.
Cancer had also gone into my bowels, my liver, my lungs and my stomach, and how did I not know that that was there? And it's just not very commonly talked about. Like, everything's about breast cancer. I'd never heard of ovarian cancer, and you still don't really hear it being talked about.
So it's really important that if you feel like something's wrong, dig deep, go find answers. Being diagnosed at stage 1 or stage 2 means that you will live longer. Being diagnosed at stage 3 or 4 with an ovarian cancer actually limits your lifespan humongously. I want our wahine to go to the clinic and say something's not right and to be taken seriously. Our ovaries carry children. They're the way of the future. So why aren't we looking after them better? Why can't we get early detection testing? Why are these things not a priority?